Okay, so get this right. Imagine all those tiny little electrolytes in your body, the ones that keep everything running smoothly. Now imagine them just going completely haywire.
Uh-oh. Sounds like trouble.
It is trouble.
Yeah.
That's actually what happens to people dealing with adrenal insufficiency. And that's exactly what we're diving deep into today. How this condition, which affects, the adrenal glands and their ability to make all those vital hormones, how it messes with sodium and potassium levels.
It really does. And I think it's a point that often gets missed. We focus so much on the missing hormones themselves, the cortisol, but it's the consequences of those missing hormones that really have that big impact on someone's life. And electrolytes are a perfect example of that.
Couldn't agree more. So before we get into all that electrolyte chaos, can we back up just a little? Can you give us that quick overview, that reminder of what the adrenal glands actually do and what happens when they're not doing their job?
Sure. Think of your adrenal glands as these little hormone factories, like little caps sitting right on top of your kidneys.
Okay, got it. Hormone factories.
Yep. They make cortisol, aldosterone, and a handful of other important hormones. But in adrenal insufficiency, production of these hormones takes a nosedive. And that's when we start seeing problems.
And we're focusing mainly on cortisol and aldosterone for this deep dive, right?
Right.
Okay, cool.
So cortisol, often called the stress hormone, and for good reason, it helps us deal with all sorts of stress. Think like physical exertion, emotional strain, that kind of thing. It's also really important for regulating things like metabolism and blood sugar. Aldosterone, on the other hand, well, it's the key player when it comes to electrolytes, especially potassium. It basically tells your kidneys how much potassium to keep and how much to get rid of through urine.
Okay, so that brings us right to potassium.
Yeah.
If aldosterone levels are low, which happens in adrenal insufficiency, what's happening to potassium?
Mm.
Is it just building up in the body?
You would think so, right? I mean, it seems logical.
Right, exactly.
And often, that is what happens. Low aldosterone makes it hard for the body to flush out that excess potassium, which leads to hyperkalemia. That's just the medical term for too much potassium in the blood. And that can be a real problem. It can even affect your heart rhythm and cause muscle weakness.
That makes sense. But the research we have actually says that not everyone with adrenal insufficiency develops hyperkalemia. So how is that possible? Because, it seems pretty straightforward. Like if you can't get rid of the potassium effectively, those levels are going to be high.
You've hit on something really interesting there, because it really shows how complex and amazing our bodies truly are. It turns out there are like backup systems in place. We call them aldosterone-independent mechanisms. They can step in and help regulate potassium even when aldosterone is low.
So there's a plan B for potassium regulation. That's pretty cool.
Exactly, and some of those mechanisms involve other hormones stepping in, others involve changes within the cells themselves, how they handle potassium. It really shows how adaptable our bodies are and how they can find ways to compensate, at least to a certain degree, when things go wrong.
That is fascinating. So we've talked about potassium. Now, what about sodium? How does adrenal insufficiency affect sodium levels?
Well, that's where the relationship between cortisol and aldosterone gets really interesting.
Okay, I'm ready. How do they work together, or maybe not work together, to affect sodium?
All right, so first, we need to bring another hormone into the mix here, ADH. That's antidiuretic hormone. You probably know it as the hormone that makes you pee less. It basically tells your body to hold on to water.
Okay, less peeing, more water in the body. Makes sense. But how does all that affect sodium?
Think about it like this, right? You've got a glass of salt water. Now, if you add more water to that glass, what happens to the salt concentration?
It goes down, it gets diluted, right?
Exactly. The same thing happens with sodium in your blood. More water means a lower concentration of sodium, and that leads to hyponatremia, which is, low sodium
Yeah,
levels.
okay, I'm following you. So low cortisol leads to more ADH, more water retention, and ultimately diluted sodium levels. Makes sense. But what about aldosterone? You mentioned that was involved too, right?
Oh, absolutely. It is. Aldosterone's job is to help your body hold on to sodium. So when aldosterone levels drop, you actually lose more sodium in your urine. That further contributes to hyponatremia.
So it's like a double whammy on those sodium levels.
Exactly. And to make things even more complicated, that sodium loss caused by low aldosterone, it can actually trigger the release of even more ADH. Your body senses a drop in fluid volume and goes into overdrive trying to hold onto water to compensate.
Ah, so it's like a vicious cycle. Low aldosterone leads to sodium loss, so that triggers more ADH, which then dilutes the sodium even further. It's like this domino effect happening in the body.
You got it. And that's why understanding those mechanisms is so, so important, because it shows just how significant these hormonal imbalances can be. They don't just affect one thing, they set off this cascade of events that can impact multiple systems throughout the body. But we should unpack that a bit further. What are the specific mechanisms at play here?
Let's do it.
Okay, so let's start with cortisol
Okay.
and its relationship with ADH.
Right.
Remember, low cortisol levels, they trigger that surge in ADH, which then leads to water retention and diluted sodium. But it's not just a simple on-off switch.
Right.
There are actually a couple of different ways that this can happen.
Interesting. Okay, so let's break it down. I'm ready for the nitty-gritty details.
Okay, great. One way involves blood pressure.
Okay.
When cortisol drops, your blood pressure can dip too.
Makes sense.
And your body, always striving for balance, right, senses this dip and says, hold on, we need to boost that blood volume. And it does that by releasing ADH to retain more water.
Okay, it's like your body has its own built-in alarm system that kicks in to try and keep things stable.
Exactly. Now, another pathway actually involves a different hormone, CRH. That's corticotropin-releasing hormone. It's a key player in your stress response. When you're stressed, your hypothalamus, which is a region in your brain, releases CRH, and that triggers this cascade of events, ultimately leading to more cortisol production.
So it's like stress, then CRH, then cortisol.
Right, but here's the interesting part. CRH can also stimulate the release of ADH. So when cortisol is low, there's less of it to suppress the CRH, which means more CRH is roaming around, and that can trigger more ADH release. It's another factor contributing to that water retention and hyponatremia.
Okay, so low cortisol has this ripple effect, not only directly affecting ADH, but also indirectly increasing it through CRH. Man, this system is complicated. And the research mentions a third, even more direct link between cortisol and ADH, right?
Yes. It seems like cortisol might actually directly suppress ADH secretion. So when cortisol levels are low, you lose that suppression. That contributes even more to increased ADH and, you guessed it, more water retention.
So it's like cortisol is putting the brakes on ADH, and when those brakes are released, ADH goes into overdrive. Okay, so we've got those multiple pathways leading to that increased ADH and hyponatremia. What about aldosterone? How does aldosterone deficiency lead to low sodium?
So remember, aldosterone's main role is to help your body hold on to sodium. When those levels are low, your kidneys excrete more sodium in urine, which is a process we call salt wasting. And this loss of sodium can have a couple of important consequences.
Okay, so help me connect the dots here. How does losing sodium from the body lead to low sodium levels in the blood? Because it seems like they should be opposite effects.
That's a great question, and it really highlights that difference between the total amount of sodium in your body versus its concentration in your blood. When we're talking about hyponatremia, we're talking about the concentration, not the total amount.
Ah, okay, so you can lose sodium from your body, but still have a low concentration of sodium in your blood. I get it.
Exactly. Think about it like that glass of salt water again. If you pour out some of the water, you've reduced the total amount of salt, right? But the salt water that's left behind is now more concentrated. In hyponatremia, it's like you're adding extra water to the glass, which dilutes that sodium concentration, even though the total amount of sodium might have actually decreased because of that salt wasting.
Okay, that's a really good analogy. It helps to picture it. So salt wasting contributes to hyponatremia by decreasing the total amount of sodium. And the body responds by holding on to water, which then dilutes the remaining sodium even more. But how does that salt wasting, that loss of sodium, lead to that water retention in the first place?
All right. So here's where things get even more interesting. Electrolytes like sodium, they actually attract water. So when you lose sodium through your urine, water follows it right out of your body, decreasing your overall blood volume. And your body is incredibly sensitive to these changes in blood volume.
So when that blood volume drops, the alarm bells start going off again.
Right, exactly. Even a small dip in blood volume can trigger, you guessed it, the release of ADH. The body is trying so hard to hold on to water and restore that lost volume. And of course, that dilutes the sodium concentration even further. It perpetuates that cycle of hyponatremia.
Wow, so it's this whole web of hormonal signals and physiological responses all trying to keep things balanced. It's incredible, but it also seems a bit overwhelming.
It is, and it highlights just how complex adrenal insufficiency is and how important it is to understand these different systems and how they're all interconnected.
Absolutely. Speaking of understanding, the research also mentioned something called osmotic demyelination syndrome, which sounds pretty serious. Can you explain what that is and how it's connected to all of this?
Yeah, absolutely. And it's really important to understand this, especially when we start talking about treatment. Osmotic demyelination syndrome is a severe neurological condition, and it can actually occur if sodium levels in the blood are corrected too quickly.
So it's not just about getting those sodium levels back up, it's about doing it at the right pace.
Exactly. The brain is very, very sensitive to changes in sodium. If those changes happen too abruptly, it can damage something called the myelin sheath, which is like a protective covering around the nerve fibers in the brain.
That sounds pretty scary.
Yeah.
So how do doctors avoid that when treating hyponatremia? Is there a way to make sure those sodium levels increase gradually?
Yeah, so it's all about careful monitoring and making sure that correction happens slowly. Doctors will usually use intravenous fluids to slowly increase that sodium concentration over time rather than trying to fix it all at once.
So it's a slow and steady approach to avoid those rapid changes that could overwhelm the brain. Got it.
You got it. It's always better to be cautious when we're dealing with these types of electrolyte imbalances, especially the ones that can impact the brain.
This is all so fascinating, and it makes it really clear why it's so important to get medical help if you're experiencing any symptoms like fatigue, muscle weakness, or dizziness. Those can all be signs of an electrolyte imbalance. Catching these issues early on and getting the right treatment can make a huge difference. But before we move on to treatment, I'm curious about the long-term effects of these electrolyte imbalances. What happens if they aren't addressed?
Yeah, so if those imbalances aren't treated properly, both hyponatremia and hyperkalemia can lead to some pretty serious complications. Hyponatremia, for example, it can really affect the brain, especially in severe cases. We're talking confusion, seizures, coma, even life-threatening situations.
Wow, that's intense.
It is. And even if it's not that severe, chronic hyponatremia has been linked to problems with gait and balance, which, can increase the risk of falls, especially as people get older.
Right, so even what might seem like mild electrolyte imbalances can have this really big impact on someone's life. It's not just about feeling a bit tired or weak. It can actually affect your mobility and overall health.
Exactly. And then hyperkalemia, that can be just as concerning, if not more. The heart is particularly sensitive to potassium levels. If there's too much potassium, it can disrupt your heart rhythm, lead to arrhythmias.
And those can be really dangerous too, right? Life-threatening even.
Absolutely.
Okay, so these electrolyte imbalances are definitely not something to mess around with. But let's switch gears a bit now and talk about treatment. We've touched on how replacing those missing hormones, cortisol and aldosterone, can help manage these issues. Can you kind of walk us through how that actually works, the specifics of it?
Sure. So let's start with cortisol replacement.
Okay.
It's really the cornerstone of treating adrenal insufficiency, and it plays a crucial role in correcting both hyponatremia and hyperkalemia.
Okay, so back to cortisol, that stress hormone we talked about.
Yeah.
How does replacing it help with hyponatremia specifically?
Remember how we were talking about low cortisol leading to that increase in ADH and all that water retention?
Right.
Well, when you give the body back the cortisol it's missing, you're basically restoring that hormonal balance. Ah, okay.
Helping bring those ADH levels back to normal and reducing that water retention.
So it's putting those brakes back on ADH, letting that sodium concentration rise back up to normal.
Exactly.
And what about hyperkalemia? Does cortisol replacement help with that too?
It can. It definitely can help to some extent. Now, cortisol's main role isn't really potassium regulation, but it does have some, we call it mineralocorticoid activity. It can act a bit like aldosterone, helping to get rid of potassium.
Oh, interesting. So if cortisol can act like aldosterone a little bit, wouldn't that be enough to manage hyperkalemia in most cases? I mean, why even bother with that mineralocorticoid replacement?
That's a really good question.
Yeah.
And it highlights, just how nuanced treating these imbalances can be. So cortisol can help with potassium, but usually it's not enough to completely manage hyperkalemia, especially for people with primary adrenal insufficiency, because their aldosterone production is really compromised.
Okay, so cortisol can lend a hand, but it's not the MVP when it comes to potassium. That's a good way to put it. In those cases, we need to bring in, like, the big guns. Mineralocorticoid replacement. That involves giving a synthetic version of aldosterone. It's a medication called fludrocortisone, and that directly targets those kidneys and helps them excrete that extra potassium more efficiently.
Got it. So you're basically giving the body back the aldosterone that it's missing.
But how do doctors know if the treatment is working? I mean, what are they looking for specifically?
Well, it's a combination of things. They'll monitor symptoms and lab values. So they'll ask about any symptoms that can point to an electrolyte imbalance, like, for instance, postural hypotension.
Oh, yeah. That's when you get dizzy or lightheaded when you stand up.
Exactly.
I've definitely experienced that before.
And they'll check things like blood pressure and pulse in different positions to see if there are any like really noticeable changes, because that can also be a sign of fluid imbalance.
Yeah, those are all pretty straightforward ways to check on how someone's feeling and how their body's handling those electrolyte issues. Right. And then, of course, they'll monitor those serum potassium levels regularly, make sure they're in a healthy range. But there's another test that can be especially helpful when we're looking at how well that mineralocorticoid replacement is working, measuring plasma renin activity.
Oh yeah, renin. Remind me about renin again. That's part of the system that controls blood pressure, right?
Exactly. It's an enzyme that basically kickstarts this whole cascade of events that leads to the production of aldosterone. When those aldosterone levels are low, the body tries to compensate by increasing renin production.
So if renin activity is high, it basically means the body's screaming, "We need more aldosterone."
You got it. So by measuring that renin activity, doctors can get a really good idea of how effective that mineralocorticoid replacement is and adjust the dosage as needed. It's all about fine-tuning to hit that sweet spot.
It's incredible how much goes into managing electrolytes. You have to think about hormones, symptoms, lab results, even enzyme activity. It's like putting together a puzzle.
It really is, and it shows how important it is to have a really knowledgeable and attentive healthcare team when you're dealing with a condition like adrenal insufficiency.
Absolutely. I think we've done a good job navigating the confusing world of electrolytes in adrenal insufficiency. We've learned how those low cortisol and aldosterone levels can really throw those important electrolytes off balance. And we've seen how replacing those missing hormones can help restore that balance.
Yeah, it's been a good discussion.
It has.
Yeah,
But this is just one piece of the adrenal insufficiency puzzle, right?
it is. And it's important to remember that, we focused on sodium and potassium today, but there are all these other electrolytes that play vital roles in our bodies. Things like magnesium, calcium, phosphate, they're all essential.
That's right. And as you learn more about adrenal insufficiency, think about how it might be affecting those other electrolytes too. Could there be imbalances that we haven't even talked about? I mean, it's a whole other area to explore.
Right. Absolutely. It really just reinforces how important it is to stay curious and keep learning about our bodies and the conditions that can affect them.
Couldn't agree more. Well, thanks for joining us on this deep dive into the intricate world of adrenal insufficiency and electrolytes. We hope you've learned something new and that you feel empowered to ask questions and advocate for your health. Until next time, stay curious.
Oh, yeah, definitely. If they're not treated, those imbalances can cause real problems. Hyponatremia, for example, it can really impact the brain, especially when it's severe. We're talking, things like confusion, seizures even, coma. It can even be life-threatening.
Wow, that's serious.
Yeah. And even when it's not that severe, chronic hyponatremia has been linked to problems with gait and balance, which can increase the risk of falls, especially in older adults.
So even what might seem like mild electrolyte issues can really have a big impact on someone's life. It's not just like feeling tired or weak. It could affect mobility and overall health.
Exactly. And hyperkalemia can be just as concerning. The heart is very sensitive to potassium levels. Too much potassium can disrupt heart rhythm, lead to arrhythmias, which can be dangerous.
Yeah, for sure. Life-threatening even. So we've established that these imbalances are not something to take lightly. But let's talk about treatment now. We've talked about how replacing those missing hormones, cortisol and aldosterone, can help manage these issues. Can you break down how that actually works?
Sure. Let's start with cortisol replacement. It's really the foundation of treating adrenal insufficiency, and it plays a key role in correcting both hyponatremia and hyperkalemia.
Okay, so back to cortisol, the so-called stress hormone. How does replacing it help with hyponatremia?
Remember how low cortisol leads to increased ADH and all that water retention?
Yeah, I remember.
Well, by giving the body the cortisol it needs, you're restoring that hormonal balance, and that helps to normalize ADH levels and reduce water retention.
So it's kind of like putting the brakes back on that ADH, allowing those sodium levels to come back up. What about hyperkalemia? Does cortisol replacement help with that as well?
It can, yeah. Cortisol does have some what we call mineralocorticoid activity, so it can kind of act like aldosterone to a certain extent, helping to excrete potassium.
Oh, interesting. So if cortisol can act like aldosterone, wouldn't that be enough to manage the hyperkalemia in most cases? I mean, why even bother with mineralocorticoid replacement then?
That's a great question, and it really shows how nuanced treating these imbalances can be. Cortisol can help with potassium, but it's usually not enough to fully manage hyperkalemia, especially for people with primary adrenal insufficiency, since their aldosterone production is so low.
So cortisol can help out a bit, but it's not the main player when it comes to potassium.
Right. In those cases, we need to bring in the heavy hitters. Mineralocorticoid replacement. We give a synthetic version of aldosterone, a medication called fludrocortisone, and that directly targets the kidneys, helps them excrete more potassium.
So you're basically giving the body back the aldosterone it's missing.
Mm.
But how do doctors know if that mineralocorticoid replacement is actually working? What are they looking for?
Well, it's a few things. We look at symptoms and we check lab values. So we'll ask about any symptoms that might suggest an electrolyte problem, like, for instance, postural hypotension.
That's the dizziness when you stand up.
Right.
Yeah.
We'll check blood pressure and pulse, things like that, in different positions to see if there are any big changes, because that can also mean there's a fluid imbalance.
Okay. Yeah, those are all pretty simple ways to get a sense of how someone's doing and how their body's handling things.
Exactly. And of course, we'll check those serum potassium levels regularly, make sure they're within a healthy range. But there's another test that can be really helpful to see how well the mineralocorticoid replacement is working. And that's measuring plasma renin activity.
Oh, yeah, renin. Yeah. That's part of the system that regulates blood pressure, right?
Yeah, exactly. Renin is an enzyme. It starts this whole cascade of events that leads to aldosterone production. When aldosterone levels are low, the body tries to make up for it by increasing renin production.
So if renin activity is high, it's like the body's saying, hey, I need more aldosterone.
Exactly. So by measuring that renin activity, we can get a good sense of how effective the mineralocorticoid replacement is and whether we need to change the dosage. It's all about finding that right balance.
It's amazing how much goes into managing something like electrolytes. You have to consider hormones and symptoms, lab values, even enzyme activity. It's a lot to juggle.
It is, and it shows how important it is to have a knowledgeable and attentive healthcare team when you're dealing with a condition like adrenal insufficiency.
I completely agree. Well, I think we've covered a lot of ground today. We've learned how low cortisol and aldosterone can throw those key electrolytes out of whack, and we've seen how replacing those hormones can help restore balance. But it's important to remember that sodium and potassium, those are just two electrolytes, right? There are others out there, like magnesium, calcium, phosphate. They all play important roles in the body. So as you continue exploring adrenal insufficiency, think about those other electrolytes too. Could there be other imbalances that we haven't even talked about today?
Definitely something to think about. It really shows that it's important to keep learning and stay curious about our bodies.
Couldn't agree more. Well, thanks for joining us on this deep dive into adrenal insufficiency and electrolytes. We hope you learned something new and that you feel empowered to ask questions and advocate for your own health. Until next time, stay curious.